This is CityCast Seattle. I'm Jane C. Hu, and here's what Seattle's talking about. 4 years after Roe v. Wade was overturned, what does abortion care look like in Washington now? And how should journalists and media outlets wield their power in deciding what to cover? But first, in June, the King County Regional Homelessness Authority released its 2026 point-in-time count, which showed not only an overall increase in unsheltered homelessness in our region, but in particular, an increase in unsheltered families and children. Here to discuss is Dominique Alex, CEO of Mary's Place, an organization that works to house women and children. Welcome to the show, Dominique.
Thanks for having me.
So what were your initial thoughts when you heard the results of KCRHA's point-in-time count from this year?
The point-in-time count, also known as the PIT count, is one of these long-awaited data sets that everybody kind of anticipates coming out. So we were anxious to hear the story. What is the data telling us? Because we're living a story every day. So honestly, nothing that we really saw was surprising, but it's also nice for it to be quantified and sharing that with the entire community to have a better understanding of the homelessness landscape.
Yeah. So I know the report pointed to a reduction in family shelter beds as one possible reason for this increase in unsheltered families and children. Why did that occur? And also, I'm curious what kind of demand Mary's Place is seeing for housing for women and children.
Yeah, I'll start with the demand so people can understand kind of what's happening with family homelessness. So at Mary's Place, we operate the emergency King County intake line for families seeking emergency shelter today. We operate that line 365 days a year. And so every day we're getting anywhere between 40 and 50 calls for families seeking emergency shelter bed. And we are only able to bring one or two of those families in per day across all of the family shelter beds. So not just at Mary's Place, but any of our partners also providing those beds for families. And that's heart-wrenching, right? Mm-hmm. What we do know is that there are babies and children sleeping outside with their families, and that is not okay. And so fast forwarding to thinking about this PIT count, what we saw was this increase in unsheltered family homelessness, as you've noted. And there's a few things that have supported some of those numbers. And some of that is that there's been some closures of smaller shelters, both at Mary's Place as well as others in our community. We strategically and financially had moved away from providing congregate shelter. And so that would be like if you were in a gym and there were curtains that kind of divided spaces into smaller rooms so families could have their own space. Health and safety wise, spaces like that were not good for families and then for dignity. So we have strategically moved to operating into single rooms for each family member to have. We also were operating a shelter that was in Bellevue, and we, in our business, have gone in and out of buildings temporarily that were slated for demolition. So we rent a hotel. The developer was going to redevelop the space, but we got to utilize that space to provide shelter temporarily. So that time had come to a close. And then we also were preparing to do a redevelopment project, which we're really excited about out in Burbank. But what we do know is that those calls that we are getting, if we had one more shelter here, about 200 beds, all of those families could come in today. And so we know that if we had one more shelter here in King County operating, we would have no child sleeping outside.
Yeah, it sounds like we're in kind of maybe a transition period between the COVID era and looking forward. So you mentioned if there were just one more shelter, that might be enough to fit that demand. Are there active plans to build that one more shelter? And when might we see that? Like, at what point might we actually be able to meet the demand for housing?
Yeah. So one of the things that we're really excited about is the mayor and the city of Seattle, as well as the King County executive, both have plans to increase shelter capacity. They have some executive orders that are out there. And those are opportunities, right? And so we are hopeful that families will be a part of that. And we are very hopeful that we will have one more shelter. Mary's Place does not have in its footprint or its budget at this very moment to just open another shelter. It's very costly to operate shelter. But we do know that if an opportunity presented itself, we would love to learn more about that and be a part of that partnership. And so we're advocating for family shelter in our community between those two pieces of legislation that we know are coming forth.
What are the specific barriers to building housing and shelter for families and children versus just general housing and shelter?
There are many other components than just dealing with an individual, right? As an individual, it's about you waking up every day. Maybe you're going to your job or you're seeking housing that you can maybe stay in a studio or one bedroom. But for families, there's a lot more complexities, right? And I know there's more complexity than that who are dealing with homelessness. But when you think about families, they're thinking about their children's going to school or childcare and how they're going to be navigating maybe a health crisis that they have in their family that is causing families to think about, do I get my child's next treatment? Do I pay for groceries day or my rent? And so those are the kinds of questions families are asking when they're hitting those crises of homelessness. And it's usually, families are just usually working paycheck to paycheck to try to survive. But it's thinking about all of those pieces with your child, right? And so for families, the affordability of housing and finding housing that is the right size. So a single mom who maybe has 3 kids, she needs at least a 2-bedroom, if not a 3-bedroom, to fit her whole family. But the cost of housing here, especially with inflation and the cost of rent, is astronomical, right? And so she's depending on one job or 2 jobs sometimes, living paycheck to paycheck. You can't afford to have a crisis happen to you because it puts her right back on the street with her family.
I'm also thinking about how routines and stability can be really important. And also just thinking about transportation for that many different people. If you've got to get to schools, you've got to get to work, like all of that is just, I think, more difficult to figure out with a family as opposed to just being a single person who's being responsible for themselves. So I know one criticism of the initial point in time count was that it was potentially an undercount of certain communities based on how the count was done. I believe there were vouchers that people could redeem, and that was a way that KCRHA was trying to keep track of how many folks were part of that count. I'm curious if you feel like the numbers that were released in June adequately captured the population of unsheltered families and children, or if the way that count was done might also affect the overall picture that we got of that population.
Yeah, one of the things that I would say I pride the partnership with King County Regional Homeless Authority, with our agency and many other family providers, is that they have been working really hard over the last couple of years to make sure that the family count is done accurately, taking many different avenues, even that King County emergency intake line that I was speaking to, like making sure that they're working with those folks on our line to understand, like, not only who's sleeping in our shelter, right, but also like who's calling every day, where are they calling from? We keep data quarterly, and so sharing that, but also knowing like where are families with our outreach program. So we have shelter, but we also have an outreach team that meets folks in their cars and their tents, and we know where people are. And so being able to have those partnerships where there's trust and being able to make sure that the numbers are counted accurately, we're very confident in the numbers that we see. But there's always going to be an undercount, right? Everyone is not always going to come forth. When you drive off of your freeway ramp, when you're maybe walking through the downtown corridor, you don't see families. And that's not by accident. Families are typically hiding in an invisible part of the crisis because they're afraid of losing their children. They're trying to keep them safe. They're trying to stay together until they can come inside and have a good solution for stability.
Well, Dominique, before I let you go, is there anything that you wish our listeners knew about your work or about homelessness in King County?
Yeah, I talked a little bit about our shelter services and our outreach program, but we have a third prong that we're really excited about, and that's our prevention program. And prevention is really thinking about how do we provide that rental assistance for a family that's at imminent risk of eviction, and also providing stability support. So we know that they can stay where they're at and have those opportunities to thrive. It's way more cost effective and less trauma on children. And it's breaking those generational cycles on homelessness, because we know the future predictor of homelessness is someone's past experience with it. So when we break that cycle on children, they don't know anything about that experience of homelessness.
Dominique Alex, CEO of Mary's Place, thank you so much for joining us today.
Thank you so much for having me.
When we come back, we'll talk about the future of telehealth abortion in Washington. When Roe v. Wade was overturned in 2022, then Washington Governor Jay Inslee issued a statement saying our state will remain a sanctuary for any person seeking abortion care and services. Many abortion rights activists have worked to improve access to abortion pills, especially through telehealth, as a way of maintaining people's rights to abortion care. And a new study sheds light on what patients seeking care actually want, and that could inform what policies look like in Washington in future years. Freelance journalist Megan Burbank covered this in a piece that has been published in CHUM News and Range Media. Welcome to the show, Megan.
Thank you. I'm happy to be here.
Also joining us is Adam Willems, journalist and co-founder of CHUM News. Hi, Adam.
Hello.
So, Megan, what is the upshot of this new study?
I would say even before Roe versus Wade being overturned was really in the national conversation, there was a lot of chatter among reproductive rights activists and reporters covering this issue, suggesting that sort of the solution to access long-term would be medication abortion, specifically via mail. So you could do like a telehealth appointment with a licensed clinician and then have FDA-approved drugs mailed to your home. This study shows it's a little bit more complicated. This was a University of Washington study of 37 people who traveled to Kansas from other states for abortion care. And what the study found was that many of them were not really clear on the legality or the legitimacy of telehealth and abortion with medication sent by mail. So there were a lot of concerns about being prosecuted for using this as a resource. There was a lot of concern about whether the drugs were legitimate. And so it just wasn't as frictionless a process as I think that some of the framings we've seen would suggest.
Does this square with what you've been hearing from providers and patients otherwise?
100%, yes. I would say it's often just more complicated than a lot of the framings you see. And I think this is a situation where telehealth and medication abortion have been revolutionary, right? I think it's something like 63% of all abortions are medication abortions now. That wasn't true when the drugs were approved for this in the early 2000s. So I would say, like, yes, it's an important tool for people to have access to. But I think what we're seeing is that in-clinic procedures are always going to need to be part of the picture as well. And so I think as we look to the future and consider the sort of burden of care that falls to states like Washington, we are looking at a continued need for in-person treatment because it's honestly sometimes it is what's needed in terms of clinical best practices, especially if we're looking at abortions that are beyond 10 or 11 weeks, which is when medications are not as effective. And then also one piece that did surprise me was that there was just sort of this interest in having a human interaction around your procedure. Yes. Which is, of course, really understandable. I think, when you go to the doctor, you don't really want to feel like a number. You don't want to feel like you're at the DMV, right? You want to feel like you're having an interaction with a human, especially around something like abortion, which is such a politically embattled procedure at this point. People can feel really vulnerable, and I think that they want that sort of clinical piece for that reason as well, because they want someone to be there to talk to them and help them through it.
Yeah, I read over that journal article as well, and that was something that stuck out to me too. I feel like it's part of this bigger trend in the world right now where, I feel like there's this interest in having increased efficiency, right? Like you can have maybe more more reach if you remove human interaction from things, but it turns out that like maybe people want that interaction. Like maybe that interaction is important to people and that is what helps them feel supported. So Megan, you mentioned, telehealth, abortion pills are obviously always going to be a part of the equation, but it seems like this data suggests that maybe it shouldn't be the whole picture and that there's always going to be demand for these in-person services. What is currently the breakdown of like how many people are seeking care through telehealth and mail order pills versus how many people are actually able to access in-person care?
So I think the most recent numbers I've seen were 63% were medication abortion. That's a huge number that's gone up significantly over the years. But that still means that a large portion of people who are getting abortions are getting what's called a procedural abortion, which is the kind of abortion that you get in a clinic. The procedure tends to be shorter. I mean, it depends on what period of pregnancy you're in. But especially like an early abortion is it's a short, uncomplicated procedure. And one of the things that really struck me in my conversation with Mercedes Sanchez, who works with, she's the executive director of Cedar River Clinics, huge abortion provider across the state. She was saying that sometimes people will come into the clinic and they're expecting to have a medication abortion, and then they learn that they can just have an in-person like procedural abortion and it'll be over that day. And they often prefer that because it's actually, going through a medication abortion is there are many reasons people choose it. It's more private. You can do it at home. It's more comfortable in some ways if there are reasons that you don't feel comfortable going to a clinic, or you don't want to have that sort of, you don't want to have a procedure. Maybe it feels less invasive or something. I think people have all kinds of reasons for preferring it. But the thing about an in-clinic procedure is it's often over more quickly. And so you go in and then you get to go home. And for a lot of people, I think that turns out to be what they want.
Yeah. I mean, and also, having a medical professional just oversee the whole thing and just be like, this is a finite, concrete procedure that has been done, and I don't have to think about it from
and
here
it's just
out.
over, right? I mean, medication abortion, I think, is a really great tool, but I have spoken to people who have had medication abortions at home. They take longer and they can be uncomfortable. And so I think there's an appeal to just being able to go in and get your procedure. An early abortion procedure takes anywhere between like 5-15 minutes. It's a short, uncomplicated procedure with a lower complication rate than a colonoscopy. So that's often what people end up preferring.
I have a question, if I can throw my hat in the ring, which is, so this piece is being co-published with Spokane's Range Media. And sort of the thinking there was, hey, this research has sort of statewide implications. I'd love to hear what you think those implications are, especially as it relates to the research taking place in Kansas. So not in Washington state, sort of like what's able to be grafted from what state versus the other versus what we need to maybe contextualize a little more. And then sort of, are there places in Washington state in particular where the implications of this research are sort of especially significant?
I think that's such a good question, Adam. So first of all, I would say Washington has a pretty unique history in terms of abortion-related travel. People have been coming to the state for a very, very long time, long before overturning Roe versus Wade was even like part of the political discussion we're having nationally. That's for a lot of reasons. I mean, one reason with Cedar River is that Washington has no gestational limit on when you can do an abortion procedure. And so for people who have like fetal or maternal indications, like it's a destination. Even before Roe versus Wade was overturned, there was this huge patchwork of different state level policies on abortion that maybe weren't outright bans, but they were 20-week bans or waiting periods or other, parental notification laws. There are all kinds of what are known as TRAP laws, so targeted regulation of abortion provider policies that could make it really hard to get care in other states. So there is this long-standing precedence for people coming to Washington for abortion care. And the reason Eastern Washington is a really important part of this conversation is because a lot of those folks historically have come from Idaho, because Idaho is much like Washington is kind of a laboratory for progressive policy. Idaho is somewhat the opposite. And so people in Idaho have had this really intense, longstanding issue with access and have often needed to come into Washington. And there are clinics that are located close to the border, in Spokane, and Cedar River actually reopened their clinic in Yakima relatively recently. So it's really an important part of the conversation. I think when we talk about abortion access, we're often focused on kind of the I-5 corridor, but it's to me, the picture has always been a lot more complicated than that. And so I think when we talk about the implications of people traveling for abortion, that's something that affects providers across the entire state. And in some cases, it can be even more relevant for folks in Eastern Washington because they are getting healthcare related travel that's happening a lot with folks who live in Idaho. And I would say that's not even just abortion. Like, people travel from Idaho for all kinds of healthcare because they can, there are parts of the state that really have limited services. And so they're often coming into Washington for all kinds of care.
Seattle in particular, when you're talking to folks who work in the medical industry, like, we're kind of the epicenter of a lot of the West, right? Like, you've got folks from coming down from Alaska sometimes even, right? Like, I feel like this I-5 corridor does sometimes de facto become where a lot of folks seek healthcare for a variety of reasons, not necessarily just abortion care.
And not just Idaho either. Like, I want to be clear, like, people come from all over. There's a lot of folks who travel from Alaska for abortion care. And then I would also say, like, the study that we're talking about is focused on people traveling into Kansas. But if you look at the states they're coming from, a lot of them are coming from Texas. And that's been true of clinics in Washington as well. I mean, since SB 8 went into effect, which was sort of the vigilante bounty hunter anti-abortion law that they passed in the state, there has been an influx of patients coming from Texas to Washington.
That's such a long way to go. But I guess I'm not surprised to hear that. Well, Megan, thank you so much for bringing us your reporting on this. Let's leave it there for now. And when we come back, we're going to talk about the role of media in deciding what the public needs to know about local news. Media, of course, always has to make calls on what to cover. And lately, I feel like I've seen more capital D discourse about the role of media in elevating some local developments into relevancy. So some recent examples of this are just general public sentiment about the mayor and public safety, and even whether media should be covering the effort to recall her. And also, there's a Seattle Times columnist who publicly announced he was quitting over editors refusing to publish a column he wrote in defense of anti-trans protesters. And he's subsequently been platformed by many national publications too, including the New York Times. So I know both of you have worked within newsrooms, making editorial calls about what to greenlight, but you've also worked as freelancers who are deciding what to cover. And I'm sure this is something you all have been thinking about too. I feel like I have been really asking myself, especially on this show, what should we spend time telling the public about? And what responsibility does any outlet or even an individual journalist have in deciding what to cover? Just a light question,
just a really easy question for all of us to answer. I think for me, one thing that I'm always thinking about, especially with reproductive health policy, is I never want to platform misinformation of any kind. You know, I get plenty of emails from folks who are like anti-abortion activists who really want me to cover things that are not real, things that are not recognized medical concepts. And I think you really have to be careful about that, because I think that historically, especially with covering abortion policy, there's been this sort of like, some people say this and some people say this type of framing that tends to kind of equalize two different perspectives. And oftentimes one perspective is rooted in science and best practices in medicine, and one is essentially like ideological. I do talk to anti-abortion activists in my work sometimes, but I think that when you're writing about something that runs the risk of feeding misinformation, you have to be really careful about the framing and who you're speaking to, and you have to really be vetting what they're saying. Like, I think that it has to have some actual news import. I think otherwise you do run the risk of kind of like feeding this kind of nasty news cycle that we're all caught up in all the time. And
the discourse machine.
I don't want to do that, right? Like, I want people to read my work, but I don't want them to like read my work and have a fit,
Yeah. I mean, one thing that I've appreciated about CHUM in particular is that I feel like CHUM does not play into that at all. But Adam, I'm curious, in your capacity, getting to greenlight stories, how do you choose what to spotlight? Mm-hmm. How do you choose what to cover?
I think sort of to Megan's point, this will answer your question, I promise. But essentially, I think that there's a conflating often in newsrooms between newsworthiness and the potential for engagement and audience growth. And that leads to a lot of sort of like stenography of like police blotter announcements. It leads to things like superficial coverage of court development or a recall effort without the contextualization of sort of like the stipulations needed for it to reach another level, or sort of like how prior recall efforts have fared, et cetera. And I think it totally plays out also in reproductive rights. It plays out in public safety sort of coverage, like I said. And so what we've been trying to do, at least from our vantage point, is, and I think this comes from Moran and myself both having like pretty long freelancer backgrounds, where we had to look at the media landscape and see where there were holes and try and address those shortcomings through our own work. Now it's kind of interesting to be like the air traffic controllers who get to commission work and accept pitches and try and incubate writing that helps fill those holes. We're trying to have the sources in our interviews be the people who are least likely to be interviewed and taken seriously by others. There's sort of like something of a blueprint there of like, how do you have your pieces not just be like, the mayor's office said this and the police department said this and the Seattle Metro Chamber of Commerce said this, but also like, hey, we interviewed like 10 students. They make up, a big part of the city, and this is what the news is to them. That's what we've been trying to do.
Yeah.
And obviously, like, not every piece is about that. Like, if you're doing like a food review, you're going to review the food. I mean, you'll also maybe review like the labor conditions and like different things that have gone on in the background. Like we did recently with the new.
It feels like it's kind of an editorial call, right? Like some publications might do that, some might not. But I mean, I think, Adam, what you're talking about makes me think of the classic journalism adage of afflicting the comfortable and comforting the afflicted, like giving a voice to people who are not always heard. I feel like sometimes it can be hard, though, especially when you're covering something like politics, or, I'm just thinking about the recent situations that I just mentioned. Like, how do you know whether you're punching down or punching up?
Totally. I think that's a very fair question. I don't think that there's like a perfect
No, I don't think there is either.
And I'd love to hear Megan's response on this too, because I think you speak to state officials. You speak, your interlocutors also come from sort of like a wide swath of backgrounds. I think audience reactions. I want to have a CHUM come out with a bumper sticker that says, "Keep honking. I'm actually reading an article in its entirety before I comment about it on social media." So if you like it, please like let CityCast know and we'll print them. But obviously like the hullabaloo that sometimes like comes out of a piece isn't all that helpful, but there can definitely be like thoughtful feedback in the form of emails or something else that can actually be constructive as it relates to sort of like our future coverage.
I feel like sometimes, and I'm sure you all have gotten this too, sometimes readers or listeners are upset that you covered something or that you didn't cover it in the way that they wanted, but they're also sometimes upset that you didn't cover something. And I sometimes ask myself, well, if everyone's kind of mad, does that mean that you did a good job? Or what does it mean?
I cover an issue that people often wish was covered more. So I don't really run into that. I think the reaction I tend to get is I will get emails from people who are like, I'm less terrified now. I mean, we see a lot of coverage of the most extreme, disturbing situations. And I think that's not always constructive, right? But I think one of the things that I often hear from people that I look for is like, I read your article, it helped me understand it, and I feel less frightened, you know? I think that's always what I'm going for is like, I think sometimes what I run into is you can get into this very dire, grim space with health policy where you're just covering things that are for lack of a better word, depressing, and people don't want to read it. They're just kind of like, I already feel like the world is on fire. I don't really want to read a story about how I can't get Medicaid access to, whatever procedure I need. So I think for me, it's often finding that sort of middle ground of like, what is the question people have about this issue? And then how can I write a piece that helps to actually explain it in a way that acknowledges the nuance, but then also like invites people in so that they feel like they can make sense of it.
I think what's interesting also is like a lot of that work involves like centering and distilling the works of experts. Hopefully this comes across the right way, but it's like you don't really need to like think outside the box when it comes to like who the interviewees are, maybe to the same extent as you do in certain other topics, when it's like, no, this person has spent, years on the ground and like they have the credentials for a reason to like then sort of your role to be to synthesize that and share that with a wider audience. Like that's such a crucial service.
Last question before I let you all go. What would be a helpful thing for folks to know about how the sausage gets made? Or what do you think would make everyone a more discerning connoisseur of local news? Another light question for you.
Yeah.
I don't know. I'm kind of with Adam. I would say, please read the whole article before you comment. Like, please, we're begging you, read the whole thing. Read it.
Yeah.
It's like
I do love it when people can read the whole thing. Yes.
Just read the whole thing.
Well, Megan, I was maybe lightly internet stalking you and read your Lindy West piece. Which I thought was actually, I remembered that I had read it. I had read it back in the day, but I saw a Blue Sky post from you being like, oh, so many of the people weighing in on this have not read the book. And yep, I mean, to be fair, I did not read the book, but I also did not weigh in on it. But I do feel like, I think that's a perfect example of how there's this incentive sometimes that conversations continue even when folks don't really have all of the source material to be sustaining a conversation. So
yeah, I'm a big fan of just like doing your homework and doing the boring thing. It's like if people are talking about this, like maybe go look at it and see what you think rather than just like hopping on the discourse. As good as that can feel, Who doesn't love to be right on the internet? And also, if you hate something we write or if you like something we write, it's very easy to get in touch and just tell us. I think I often hear from people who are like, I read this article and I hated it and this was wrong and this was wrong. And I'm just like, okay, what are you going to do about that? Like, are you just going to be upset about it? Or is this actually like, can you email the editor and say like, this needs to be corrected? Like, there are things you can do to be a more sort of active newsreader. And I think, I think it pays to actually engage deeply with the reporters in your community and to pay attention and understand that you also have agency in terms of like reaching out and drawing attention to things that are important to you.
I think totally. And at the same time, I think news outlets could do a better job of transparently outlining what it would take for readers to submit sort of like, their fact checking requests, or, like, what are the accountability mechanisms that exist at these publications that like think of themselves as part of this larger estate?
Absolutely. Megan Burbank, thank you so much for joining us.
Thanks so much. This was really great.
So glad to have you. And Adam Willems, as always, great to see you.
Thank you. Likewise.
I'm your host, Jane Sihu. Listeners, we actually do love hearing from you all. We have gotten, I feel like, a real grab bag this week of folks who have loved some things we've done and also have suggestions for how we could have improved or perspectives they want to hear from. And if you have thoughts on any of our recent coverage, you can send us an email at seattle@citycast.fm. You can also always text us or leave us a voicemail at 206-880-3931. Until next time, see ya, Seattle.